Hello and a very good afternoon to one and all. My name is Dr. Charita Pradhan and I am the consultant coloproctologist at Apollo Hospital, Navi Mumbai. Today I am going to be talking on a very interesting and disabling topic for many of us called as fistula in anus. Now what is fistula in anus? This is an abnormal connection between the anus, which is the external passage from where we pass stools, to the surrounding skin around the anus. Now, why does this happen? There are many reasons why this happens, and one of the commonest reasons is an infection in that area. This infection can arise from a lack of hygiene in that area or sometimes prolonged sitting. Now, sometimes these infections settle down on their own, but many a times they persist in a very low-grade fashion. So we are not really aware that there is a subclinical infection going on, and this then keeps burrowing deep down inside, forming what we call as a fistula or an abnormal connection. This condition is very disabling for whoever has it, because it keeps constantly irritating you in that area. It can sometimes give rise to discharge of blood or pus from that area, and sometimes can be very painful. The best way to diagnose this is to go and see somebody specialist in that area, like a coloproctologist or a general surgeon, who will then do an internal examination and tell you whether you have a fistula or no. It is quite important as a patient to diagnose this condition as early as possible, because if not picked up in time, it can give rise to deep-seated infections and more difficult conditions like a high complex fistula, which then becomes very difficult to treat even for us as coloproctologists. The low fistula in ano is basically of two types. As I said, the fistula itself can be a low fistula or a high fistula. But even the low fistula can be just a superficial one, or it can be a much deeper one that passes through your muscles. This can only be made out or diagnosed after an internal examination by a specialist. And the reason for doing this is the treatment depends upon what kind of fistula you have. So the sooner you get it diagnosed, the easier it becomes to treat this condition. There are various ways by which you can treat the condition. If there is a lot of infection, the proctologist will first start you with some antibiotics to calm this condition down. And then the only way to permanently cure this is by a surgical procedure. There is unfortunately no medical treatment that completely cures this condition. All kinds of medicines, including antibiotics and other painkillers, will only keep the condition under control, but the only permanent cure is by a surgery. There are various types of surgical procedures available, and nowadays with the advent of laser technology, there is a minimally and very safe way of treating these fistulas. Lasers can help in a fast treatment of this fistula, less painful, and early return to your normal activities. After the surgical procedure, you can continue to pass stools. The proctologist, like myself, will usually prescribe you some kind of medications till the wound heals completely. This condition can take anywhere between 5 to 7 days to treat completely and heal completely, and in some patients can take a little longer depending on how deep the fistula has burrowed. That is why the most important thing for treatment of these fistulas is early diagnosis by a consultant who is a specialist in dealing with these kind of procedures, and then early treatment of these procedures. So once again, I reiterate that a fistula is a condition which cannot be treated by just medications. It needs some kind of surgical treatment, and that can be done only after it is properly diagnosed by a specialist. Thank you.